Hi, this is Jessica DeMassa, and I'm here at the HISA Studio here at HIC 2017, and I'm with Ian. Ian, please introduce yourself.
My name is Ian Manovel. I'm the Innovation Principal Director at Accenture.
Okay, now tell me a little bit about Innovating Health, which I understand is a project that you're working on through Accenture with HISA, is that right?
Absolutely. So we started about 2 years ago, and what we wanted was a collaboration with a peak industry body in digital health. So we approached HISA and said, we want to create an innovation roundtable series with you. How does that work for you? And HISA were really excited.
Oh, sure.
And together, we got together and we thought about how we wanted to do it. And we decided that what we would do is a series of roundtables. And then we wanted to make it a little bit more interactive. So we thought we'd put it on a website, we'd have video content, and we wanted to make sure that there were different sectors fairly representative. So every one of the roundtables, we invite people from industry, academia, and government to participate.
Fantastic. Now, talk to me a little bit about some of the challenges, I guess, that you're trying to address during these roundtables. What's the focus?
Well, we try to pick topical areas, and increasingly we actually ask the attendees to tell us what topics they'd like.
Sure.
So, for example, in the last 12 months, cybersecurity in digital health has become a real concern to people. So it went from something that people had no idea about to being on everybody's agenda. All the executives now want information about it. So we picked that as one of the topics for a roundtable.
Okay, and then typically what happens at a roundtable? Give me a little bit of a sense of what's going on.
Sure. Okay, so we don't want it to be all about HISA and Accenture. So what we do is for every roundtable, we look for an individual we call the guide. And we look typically for somebody who might be an academic or from somebody from industry who's a real expert in that particular topic area. And we invite them to be the guide for that session. So for cybersecurity, we actually had 2 guides. Okay. We had Trish Williams, who's an Australian expert in cybersecurity and health. And we also had Teresa Meadows, who came over from Cincinnati Pediatric Hospital to Australia for the conference and to be a guide. So we had 2 fabulous guides. And what they do is they interpret their view of the latest view on that topic. So everybody at the round table, and there's typically about 20 executives present, has a view of where we're at.
Okay.
And then that stimulates the conversation.
Okay, and then what are some of the outcomes, these 20 executives that participate in the roundtable? What do they do with that information now that they have it?
So it would be nice to say that they all go back to their organizations and they transform them instantly. Not so much. Look, I think we're very pragmatic and we know that people have challenges and barriers, but what we try to do is identify centers of excellence.
Sure.
So pockets of really good practice that other people can imitate, and that people can escalate that little example of good practice into the new way of working. And so that's the main benefit that we've been able to deliver, sharing that good practice of innovation and also helping organizations understand value.
And what are you seeing there in terms of that recognition of value? What's the value of having these conversations about health innovation?
So the way I look at innovation, it's very much not just doing something new, but creating value that wasn't there previously.
Okay.
Now, typically to do that, not only do you have to have a very good innovative process or service, but you've also got to be able to decommission the old way of working that was costly and inefficient. Mm-hmm. And that's been a slightly different way of thinking for some of the executives who've attended the roundtables.
Okay. So Ian, if somebody wants to participate in a roundtable, last thing, where do they go to find out more?
Well, we have a website. So it's innovatinghealth.org. And you can see there all of the 9 roundtables that we've had and the videos and the white papers and all the information there. And you can contact HISA and ask to be invited. So the CEO of HISA sends an invitation to people to attend. And we also have typically 1 or 2 upcoming roundtables that we're going to propose. And if you'd like to have a roundtable on a particular topic, you can nominate that topic. And if there's interest, we'll hold one for you.
Fantastic. Ian, thank you so much for sharing about this amazing program that HISA is working on in partnership with Accenture. We really appreciate hearing about it and invite everybody to take a look at the website and figure out how to join. Thanks so much for joining us in the HISA studio.
My pleasure.
Thank you. This is Jessica DeMassa at HIC 2017.